Well, welcome everybody to Four Points Family Chiropractic's Advanced Workshop. This one is titled How Not to Die. It was put on by Dr. Neblett. We welcome you to this. This is part of our advanced series. So we're going beyond the basics and giving you more tools that you can use to implement in your everyday life, because ultimately our goal here is to give you the tools to a better way to better health. So that's enough for me. I'm happy to introduce Dr. Tom Neblett to present the workshop this evening. Thank you.
All right. Well, good evening, everybody. I'm Dr. Tom Neblett, Four Points Family Chiropractic. I guess you figured that part out already. I want to welcome you all, as Dr. Mary just did, to our Living to 100 workshop series. Our goal in here is to provide lifestyle solutions to help you all live as healthy a life as possible. Tonight's topic is titled How Not to Die. And that title is based on a book by the same name by Dr. Michael Greger. And I want to tell you, this is born out of my own personal experience, my own personal journey, if you will. Decisions I made after being exposed to his material and some other doctors I'm going to share with you tonight. Very important studies. I don't know if any of you guys have been through this, but I've had issues with weight from time to time over my life. My father's a medical doctor. I was born in a medical family. Everybody in my family that I grew up with has struggled with weight at different times. As a result, I've tried various different dietary programs over the years. I've done Atkins, done keto, done all the things. And I don't know about y'all, but it gets confusing. You know, what's the truth about diet? Because there's one camp saying this, another camp saying that. What's the truth? And what I found in listening to these guys, I started listening to a doctor named Dr. Neil Barnard talk about reversing type 2 diabetes. Made a huge impact on me. Had patients in our practice who had diabetes, who had family members with diabetes. And the more, when I listened to Dr. Barnard's work, I really became convicted to make some changes in my own lifestyle. So for the last 6 months, I've been completely vegan as a result of what I listened to by him. So I'm going to share some of these ideas with you. I'm not trying to encourage anybody to jump off a cliff, but any changes made in this direction are beneficial. I'm going to share, and you guys take from it what works for you. So back to the book, How Not to Die. What Dr. Greger does in his book is he took the 15 leading causes of death in the United States, all right? And he looked into each one of them. He's a rabid researcher, and in his book, he dedicates a chapter to each one of these diseases and identifies specific dietary causes to each of these diseases. He also identifies dietary solutions. But at the end of his book, the conclusion he comes up with is the number one cause of death in America is our diet. All right, pretty heavy stuff. So there's good news and bad news to that. You know, the bad news is what we're eating is not working very well. The good news is we can change that. I would a lot rather hear that's my problem than hear I had some kind of genetic disease that I had, there was nothing I can do about it. And so that's not what he tells us in this book. So how did we get here? All right, we got here because of our diet. This looks at what happened with meat intake since the early 1900s. Our meat intake is increased from about 124 pounds per person to a height back in around 2004 of a little over 200 pounds per person a year. By the way, that's a yearly number. And it dropped a little bit by the end of the study, but still a dramatic increase in the amount of meat that we've eaten. And we look at chicken intake, just for fun. Chicken intake, we started out, Americans were eating about 10 pounds of chicken a year. Guess what, that went way up. In fact, about 6 times as many by the height in 2006, and then dropped down a little, but still, we're basically eating about 6 times the amount of chicken per person a year than we did back in the early 1900s. But this is where we went crazy, cheese intake. Back in the early 1900s, Americans were eating about 4 pounds of chicken a year. Not too bad, right? Well, something happened in the 50s and 60s. What happened in the 50s and 60s? What changed about our eating culture? Think girls on roller skates. Fast food, exactly. All of a sudden, burger joints showed up, and pizza showed up. And pizza is basically a piece of bread with a bunch of cheese on it, right? That showed up. And our cheese intake skyrocketed up to 33 pounds per person per year, a 10 times increase in cheese. And just so you get a little behind the scenes information on that, cheese is 70% saturated fat. So that means all 3 of these increase the fat intake in our diets. And the result of that were these things. Number one, right now more than 2/3 of the American adult population is overweight. We define overweight as having a body mass index number of between 25 and 29.9. How many of you in here are familiar with body mass index? If you've been through our workshops here, you are. That is a biometric number. It is a number where we find the ratio between height and weight. And there's a healthy range, which is between 20 and 24.9. Now, if you want to find out your own BMI, I can give you the formula, but the easiest way is Google BMI calculator. It'll pop up a little calculator, plug in your height and weight, and it'll tell you where you fall on these numbers. Healthy is between 20 and 24.9. Currently, 2 out of 3 Americans are outside of that range, and 1 out of 3 Americans are obese, which is a body mass index greater than 30. All right, so we've got a weight problem in America. What has gone along with that is 1 out of 3 Americans currently die from heart disease. And if we go beyond that, 1 out of 3 Americans currently has either diabetes or pre-diabetes. And estimates are in the next few years we'll see 1 out of 3 Americans with diabetes. I'm going to talk later about why that's such a big problem. So this is where we find ourselves. And unless you struggle from some of these, it may not be that personal. But by the end of the time we talk, I hope that we all see the implications for ourselves. Now, let's talk about heart disease first. In Dr. Greger's book, he identifies coronary artery disease as the #1 cause of death in America. The coronary arteries are the arteries that are on the heart. Okay, they crown the heart. That's what coronary stands for. So what he says is 375,000 people a year in America are dying from coronary artery disease. Now, the risk factors for developing that are as follows. As you see up here, high cholesterol, tobacco use, high blood pressure, overweight and obesity, which we just spoke about, physical inactivity, and diabetes. So that's the bad news once again, but the good news about that is all these are modifiable based on our lifestyle, all right? The one I'm going to focus on here for the next couple of minutes is cholesterol levels, all right, because cholesterol is the primary culprit when it comes to heart disease. I think everybody in here knows there's 2 types of cholesterol, right? We all know that. There's good cholesterol and bad cholesterol. Bad cholesterol is the LDL cholesterol, low density lipoproteins. And the reason that's called bad cholesterol is because what that does is it deposits cholesterol into the lining of our arteries and forms what are called plaques. And that's what atherosclerosis is. So as the cholesterol levels in our blood rise, the body has to do something with it. So it's the LDLs deposited into our artery linings. Now, HDL cholesterol is called good cholesterol because what it does as the cholesterol levels rise is it attaches to the cholesterol, shuttles it off into our intestines, and ushers it out of the body. So that's why we want to see our HDL levels remain around 60 is the ideal range. Our LDL cholesterol we want to see below 100, right? So those are the goals that we have there. Now, so since LDL is the problem, what is it that elevates LDL cholesterol? 2 main things, saturated and trans fats. So where do we find saturated and trans fats in our diet?
Meat, protein.
Animal products, yeah. Meats, dairy, so dairy like butter, cheese, milk, eggs, those are the high cholesterol foods. That's also that's the high saturated and trans fats foods. Also processed foods. So you see the cookies and the muffins and things like that in there. And then the dietary cholesterol is the second area that we get cholesterol. That's the cholesterol that we actually eat. And where that comes from is specifically from animal products, okay? There's virtually no cholesterol whatsoever in plants, and cholesterol is found in the lean portions of animal products. So we got a double whammy with animal products then. The fat gives us a saturated fat, and the muscles, which we normally eat, gives us high cholesterol. Make sense? Now, one thing about cholesterol, our body uses cholesterol. Every cell membrane in our body has cholesterol in it, so we need cholesterol. Every hormone that's produced in our body is based on a cholesterol framework, so it has value. But our liver produces cholesterol, and our liver produces all the cholesterol that we need. So that means any dietary cholesterol that we take in becomes that cholesterol floating around our bloodstream. That if we have too much LDL, it gets deposited in our arteries. If we have enough HDL, then it gets shuttled out. Does that make sense? So that's something that we need to be aware of. Now, what is the goal that we're shooting for in America when it comes to the right amount of cholesterol? What numbers have we told is our healthy cholesterol level to shoot for? 200, all right? That's the number that we're told we should shoot for total cholesterol numbers. The problem with that is we're talking about in a country where the #1 cause of death is heart disease caused by too much cholesterol. That number's too high. All right. When the study was done, the average American had a cholesterol level of about 204, which was outside of the goal area. That's dropped a little bit in subsequent studies, but we're still too high. There were studies that were performed in the rural areas of Asia, Africa, and Latin America, where they found populations of people with cholesterol levels under 150. Now these were populations of people that ate a plant-based diet, and they found those kind of cholesterol levels. The other thing they found in those populations was heart disease was virtually non-existent. So there's lots of other studies out there where they've looked at this. One was called the China study. Right there, T. Colin Campbell did a study in hundreds of thousands of people in rural China, and they found similar results there. So there's a definite correlation between cholesterol and heart disease. The lower we can get that number, the better. And we talked about ways that we can do that a second ago. Now, there was a big study that was performed in Europe called the EPIC study. And there they were looking at types of diets and the impact that has on our cholesterol levels, therefore our likelihood of developing heart disease. They found that meat eaters had an average cholesterol level of 204. Okay, so we're above that number that we're shooting for. They found that fish eaters, these guys didn't eat chicken or red meat, but they did eat fish. Their numbers fell down a little bit, down to 196, still really higher than what we're shooting for. People that call themselves vegetarians, so they didn't eat direct meat products, but they still ate dairy and eggs, as an example. Their numbers fell even further, down to 188, but the vegans in the study that they looked at, and this EPIC study was huge, they found vegans had a cholesterol level of 170. So again, the less animal products we have in our diet, because that's where our dietary cholesterol comes from. Makes sense? All right, Dean Ornish. Anybody heard of Dean Ornish? Dean Ornish is a good old Texas boy. All right, he was born in Dallas, graduated from the University of Texas here in Austin, did his medical studies at Baylor, so he's a Baylor grad for his medical degree. When he entered into medical practice, he was appalled at what medical practice meant, because what he found he was doing with his patients was managing chronic diseases. He wanted more than that. He wanted to cure people, see people actually cure. If anybody, I'm not going to ask you to raise your hands, but if anybody's taking blood pressure medication, cholesterol medication, those type of medications, as a general rule, if you're prescribed to get on those types of medications, it's for the rest of your life. And he just found that unacceptable. He said, we've got to come up with a better way. So what Dr. Ornish did, he put together a landmark study that was published in Lancet Medical Journal back in 1990, where he took a group of people who had been diagnosed with medium to severe coronary artery disease, some of them that already had their first heart attack, and he took this group of people and put together an experiment. And what he did, put them into two groups. The first group, he prescribed some pretty hardcore lifestyle changes. Number one, he put them on a whole food plant-based diet. He had an exercise regimen he had them all doing. He put them into support groups, so they had love and support around them, and he taught them to manage their stress. Now, those of you who have been through our Quick and Better Results consult, you'll recognize 3 of those factors we put in our Quick and Better Results consult. So we're in total agreement with that approach. We just don't go quite as far as Dr. Ornish did with his diet. But what happened, the second group, by the way, he took the American Heart Association's recommended guidelines and had them follow those guidelines. Pretty amazing results came out of that. Both groups, their cholesterol levels overall lowered. Much higher lowering, though, in his group that he put on a whole food plant-based diet. The LDL levels also lowered. But if you look at his group, they lowered by 37%. Only 3% in the American Heart Association diet. Weight came down 22 pounds. This was a year-long study, by the way. Whereas the group that stayed on the American Heart Association recommended diet actually increased their weight by 3 pounds. But what was even more astonishing was the group that did the American Heart Association guidelines, their coronary artery disease actually progressed. His group, 82% of the participants, not only did their cholesterol levels come down, but he found that the lumen of their arteries actually increased in size, meaning those atherosclerotic lesions lessened. So this is a huge study, and what it shows is, by switching to a whole food plant-based diet, they've actually been able to reverse heart disease. So if anybody in this room has had issues with heart disease or has loved ones that are in that situation, I know this is a radical recommendation, but it's something to look into if you want to find a way to get people off of drugs, a healthier way of living, and avoid the #1 killer of Americans. So let's move into the next year. I could go further into that, but enough. You get the idea. Let's talk about diabetes. This is a map of the U.S., obviously, showing the prevalence of diabetes back in 1994. The darker the colors, the higher the concentration of diabetes in the population. So back then, there were 2 states that had greater than 6% diabetes in the population of the states. And what happened over the ensuing years? Check out this map. Now, I want to make this clear. This is not coronavirus, where we avoid contact and help you avoid it. This is diabetes that is created by our lifestyle.
Wow.
Look what happened. In 2005, they had to add a new category because the percentage got so much higher. I don't know what happened in 2006. Maybe a different political party came into power, but they changed the colors that year, and they also increased the numbers of what they did. But what you'll notice, to 2011, the numbers continued to get worse and worse and worse. Now, why is this a big deal? What is diabetes? Diabetes is when the sugar levels in our blood get too high, right? And the problem with that is this. When our blood is too filled up with sugar, glucose, it thickens. It becomes like molasses, if you will. And it can get through the bigger arteries. It can move through the aorta okay, but when it gets to the end of those arteries, when it gets to the capillaries that are found places like the fingers and toes, the heart, the liver, the kidneys, the male sex organ, where else? The eyes, the capillaries in those areas, it can't get through those capillaries. So in end-stage diabetes, what happens? We see extremity amputations. We see kidney failure. The number one cause of kidney failure in America. We see blindness. Number one cause of blindness in America. All these organ failures happen because the blood can't get through the capillaries any longer because it's too thick. So that's the concern. So that's why diabetes is such a serious thing, that we don't want ourselves to get in this situation, much less our loved ones. So what we're talking about, the key ingredient to getting glucose out of our bloodstream is insulin. And so what happens, the pancreas produces insulin when it's healthy and secretes the insulin into our bloodstream. And the way that works is this, looking at the cellular level. Glucose is the natural breakdown byproduct of carbohydrates, right? So carbohydrates get broken down into glucose, and regardless of what the guys on those other diets say, it is the preferred energy for our cells, glucose is, particularly our muscle cells. So what happens in a normal body is if you eat more glucose, that glucose gets pulled into the cells and gets stored as glycogen. I know that there's at least one person in the room who has done endurance racing. There may be others of you, but what do endurance racers do before their big races? They do carb loading, right? They eat large amounts of carbohydrates, because what happens, then it gets pulled into the cells, and when they're out there running their marathons or doing their Spartan races or whatever they do, they've got these carb cells that they can draw from to keep them going. Now, glucose cannot enter the cell unless it's invited in, and the invitation agent is insulin. So what happens when the body senses a rising glucose levels in the bloodstream, the pancreas kicks out insulin, and what insulin does is it acts like a key and unlocks the cell so the glucose can enter the cell. Pretty simple, right? So up until recently, the way that we treated diabetes was by monitoring glucose levels, right? Anybody in here have a loved one who's dealt with glucose? They're constantly watching their sugar levels, right? We want to keep our sugar down. We got to do that. If sugar levels get too high, we got to inject some insulin to try to get it pumped into the cells. What they found out in recent studies is it's not a problem with glucose. It's a problem with fat. Because what happens is when our fat levels get too high in our bloodstream, the fat gets deposited into our cells. All right, and doctors don't like little words like fat. They like big words. So what that's called is intramyocellular lipids get deposited inside the cells. So intra means inside, myo means muscle, and lipid means fat. So that means in the muscle cells, the fat gets pulled out of the bloodstream, deposited into our muscle cells, and clogs the cells up. So what insulin's, when we develop, what's the word I'm looking for? When the insulin sensitivity lowers, what's actually happened is our cells are so clogged up with fat that we can't get the glucose into the cells. Now, there's two places the fat comes from. One is from our diets. That's the obvious place, right? So it's the fat we eat, but it's also the fat we wear. That's where there's a tie-in with overweight and obese individuals and diabetes, because as the fat cells fill up, they cause a spillover effect, and that fat gets deposited, gets spilled into our bloodstream. We still have high levels of fat. It gets pulled into the cells and clogs up our cells. Makes sense? So that's why we see that happening. So that's why it's so important that we address these things. Now, 3 types of diabetes. Type 1 diabetes used to be called juvenile onset diabetes. That's where the pancreas no longer secretes insulin. What they now know is it's not necessarily genetic. It's an autoimmune condition, and they found a tie-in with dairy products. Okay, that dairy product stimulates in some people this autoimmune response. It then goes in and knocks out the the cells in our pancreas that produce insulin. Now the type of cell, that's a very small percentage of overall diabetes. But the type we're talking about is type 2 diabetes. Type 2 diabetes is a diabetes where the pancreas is producing enough insulin, but the cells are no longer able to use that insulin. Okay, this is the one that's taken off and producing such a problem. The other type of diabetes, gestational diabetes, that's developed during pregnancy. Not going to go into anything about that, but it's closer to type 2 than type 1. Now, so along these same lines, carbs versus animal fat, again, in the past we focused on managing carbohydrates, but Japan shows us that it's not a carbohydrate problem. What happened in Japan, as you know, rice was a traditional dietary staple of the Japanese for hundreds of years. And what we've seen happen in the last few decades, though, prior to 1980, the prevalence of diabetes in Japan was between 1 and 5% of the population. In just 10 years, that number increased to over 11 to 12% and has continued to increase since that time. So what happened that caused diabetes to increase in Japan, similar to what we saw on the slides about America? What happened was this. Japan decided to introduce the same kind of eating habits that we did in America. In the 50s, they began eating outside of the home and increased their intake of fast foods when it showed up there. And we just saw, as a result, fat content of their foods shot up immensely. The other thing that happened as they began to eat more fast food, they ate less of the traditional Japanese foods like rice, which are carbohydrates. So in theory, this should have helped their diabetes problems, eating less carbohydrates. But that hadn't been the case, as we saw at that previous slide. And what happened as a result of these dietary changes was Japan developed a weight problem. Not among the women. We saw women continue to fall within the normal BMI between 20 and 25. Where we saw the increase happen was with the men. So what's the difference between the men and women? What happened to the men that didn't happen to the women? What happened was the women stayed home while the men went to work. The women continued to eat a traditional Japanese diet, maintain their weight. The men began eating outside the home, increased their intake of fast foods, therefore their fats, and their weight has skyrocketed. So, Neil Barnard, I mentioned earlier, he has a book, Program for Reversing Type 2 Diabetes, and we make several recommendations. I'm going to condense it down into 4. Very simple. The first thing he says, the first key to reversing diabetes or preventing that from occurring is to eat a plant-based diet. All right, pretty simple, right? His second key was we've got to limit high-fat foods. Now, what are examples of high-fat foods?
Oil, salmon, beef, cheese.
Cheese. You're paying attention. Not that I would look. This is my darling daughter, by the way, who I raised on cheese. Even though you look at her, you couldn't tell. But yes, high-fat foods include animal products and oils. Okay, oil is basically 100% fat. So just to be aware of. The third thing he said was to eat foods that are low on the glycemic index. Now, everybody know what the glycemic index refers to? That's how quickly carbohydrates are broken down into glucose. All right. So what they found is processed foods, starches, sugars, foods like that, cookies, those kind of foods have a very high glycemic index. They're almost immediately changed into glucose, which causes an insulin spike, and that clogs things up in the system. But carbohydrates that are more complex carbohydrates, vegetables, fruits, break down more slowly, so it's much better handled by the tubers. We're looking at sweet potatoes here. Those foods are also carbohydrates, but they're low glycemic index carbohydrates. The other thing they said was to eat about 40 grams of fiber a day. Now, I'm going to take a second to talk about fiber, because fiber needs to have a big plug here. So fiber has several purposes, several beneficial purposes. One of them is when we eat fiber, it has virtually no calories associated with fiber. So when we eat fiber, especially soluble fiber, it mixes with water and expands. So when we eat that and it gets in our stomachs, it expands in our stomach, stimulates the stretch receptors, and our brain reads that as we're full. So we eat less. So that's important, particularly for keeping our weight down, right? But the other thing that fiber does is it's a binding agent, and it binds to things like triglycerides in our bloodstream. Cholesterol helps pull cholesterol out of our system. Estrogen, which has been shown to be a cancer-causative agent. Toxins, other carcinogens, and actually pulls them out of our system. It causes our rear end system to work better, and the back end of things, and take products on out of our body. So cholesterol, so dietary fiber is very important. How much fiber is found in animal products? 0. So we get all our fiber from plant products. So that's a very important, another aspect of eating a whole food plant-based diet. The current guidelines for the amount of fiber we should take in for women is 25 grams a day, for men is 38 grams a day. So this is recommending to go beyond that. But by and large, as a population, most of us eat less than 10 grams of fiber a day, right? So that's why this creates a problem. So we get backed up. We don't get the stuff out of our system we need to get up, and it builds up in our systems. So again, Neil Barnard, I'll mention him a little bit later on, but he has a book out about how to reverse diabetes, and that's some real basics. So the last dietary I'm going to talk about, or the last area that we talked about, is cancer, all right? Probably the words that we would most dread hearing from our doctor are, "You've got cancer," all right? And I want to tell you, this is real personal to me. I lost my sister to cancer, so I'm sure a lot of people in this room have lost loved ones to cancer, and that's something none of us want to have to hear. All right, 500,000 deaths a year in the United States come because of cancer. Now that number, I don't know if the number overall has improved, but our treatment of cancer in a lot of areas has improved. And some of the cancers that used to be automatic death threats, we're now seeing people survive them. So our treatment protocols have improved. But how many of you have known somebody that's going through treatment for cancer or had to do that yourselves? By and large, it's not a very pleasant experience, is it? It's very invasive. It's very inconvenient. A lot of times your life gets put on hold for a period of time. So wouldn't it make sense to be a lot better to prevent cancer than to depend on the treatment of cancer as the way we're not going to die from cancer? Absolutely. So that's something I hope that we can all agree on there. The 5 most common types of cancer in America currently are lung, breast, colorectal, prostate, and stomach. So we know about lung cancer, right? Now lung cancer rates, by the way, we still lose about 150,000 people a year to lung cancer. But the death rates have decreased by about 1.5% to 2% a year for the last 15 to 20 years. Why is that? Because there's fewer people smoking. Now people are vaping, which we're going to see similar results. That's another problem that's come along. But the message got out that smoking caused cancer. I want to have a little talk about that for a minute, because back in the 50s and 60s, everybody smoked, right? We watched movies from that area. Everybody in the movies are smoking. It was glamorized. It was cool. It was, everybody smoked. There were ads put out. Cancer improves digestion. I could have put all these in here, but we just don't have time. 4 out of 5 doctors choose Camel as their cigarette of choice. My father was a medical doctor. I used to go visit my father in his office in the 70s. He had an ashtray on his desk. He'd sit there smoking while he was talking to you. And part of the reason for that, they knew in the 60s that smoking caused cancer. But the tobacco industry is a very strong lobby, and they suppressed that information for years, kept it away. Now, do you think that in the boardroom, those executives were sitting around going, let's work on this. How can we cause more people to get cancer? Of course they didn't. Their conversation was a little different. Their conversation was, how can we make the most money, right? So their marketing focused on that, and they suppressed the truth about the health problems it was causing until it finally got out. And now, even at that, I've still got patients who smoke. And if any of you in the room still smoke, I just want to encourage you. I know it's a difficult thing. No judgment, no guilt, no shame, but find a way to stop. It's one of the most detrimental things that you can do to your health and implicated in so many different diseases. Now, the other 4 of these all have direct tie-ins to our diet. And I'll tell you what's going to happen at some point in the near future. There's going to be a day of reckoning for the food industries, all right? Because the food industries are suppressing information about the cancers, the way they impact cancer. And some of those are beginning to come out, but it's suppressed. I want to tell you, in my research of this, one of the things that I found out is that particularly the cattle and poultry industries, they have been able to enact laws that says if you go into one of their facilities and take pictures, you can be arrested and go to jail for espionage. That's how strongly they're guarding. They don't want people to know what goes on in those facilities. So there's a lot going into keeping us from knowing the truth about this. But every one of these has a direct relationship to our diets. So with cancer, one of the things I want you to know is how is cancer caused? All right, this is a neat little diagram that kind of explains. Cancer cells started out as healthy cells. Now, healthy cells have a life cycle, and they have a programmed death that's a part of what happens. And then they're somewhere down the road, the next cells come along and replace them. What happens when a cell becomes a cancerous cell is it receives some kind of an insult, all right, that causes it to become damaged, and the DNA becomes damaged, and then it becomes an abnormal cell and mutates. And then as the next generations of cells are created, they no longer create healthy cells, they create cancer cells. one of the problems with cancer cells is they've lost that turn-off signal that tells them to die, and they just continue to proliferate over time. Right, so that's the problem that becomes cancer. Now, so the genetic part of this, some people say, well, you know, everybody in my family's had cancer, I've got a genetic predisposition for cancer. Well, I want to dispel that just a little bit. Not that you can't have that predisposition, but there are certain genes that express themselves, period. Our eye color is a good example of that. Our gender is a good example of that. Genes that express themselves regardless. There are other genes we have that have to be activated. The fast proliferation is one of the genes that has to be activated through some kind of an insult. So what we have found out about meat, the World Health Organization in the last few years, you may have already heard that, has announced that processed meat is a type 1 carcinogen. Okay, by processed meat, I mean bacon, sausage, pastrami, pepperoni, all those meats that we love, okay? They've now declared that to be a type 1 carcinogen. What that means is there's enough evidence now that says those meats cause cancer. It's no longer a question. Other types of type 1 carcinogens are cigarettes, asbestos, plutonium. So if you eat bacon as part of your breakfast every day, then you might as well smoke a cigarette at the same time. If you serve your kids, and I don't mean this to be ugly, but maybe I do, if you put bacon or sausage links on your kids' plates, you might as well give them a cigarette to smoke, because they now know it's in the same class as cigarettes. Startling news, but this is from the World Health Organization. They have said that red meat, mainly red meat is what they talked about, is a type 2A carcinogen, which means there's enough evidence that says it's a probable carcinogen. All right, I'm going to talk about some of the reasons for that. Now, also it's come out, there's direct links now with chicken and cancer. There was a study done where they looked at pancreatic cancer. Pancreatic cancer is one of those cancers that you don't want to get diagnosed with. There's only a 6% survival rate 2 years after the diagnosis. So if you get pancreatic cancer, that's a pretty tough one to overcome. They found that people that eat 50 grams of chicken a day, this was in the EPIC study in Europe with 477,000 people they looked at. If you eat 50 grams of chicken every day, your chances of developing pancreatic cancer increase 72%. All right, so those are pretty staggering numbers they looked at. They looked at poultry workers. So that's pretty shocking stuff. So we know there's problems with eating these things. Now, one of the problems is that when we cook meats, one of the compounds that's formed is called heterocyclic amines. Okay, that's caused particularly by meats cooked at a high temperature, like grilled meats. That's the worst way we can eat meats. It used to be my favorite way to eat my meats. Grilled meats, they find an increase in heterocyclic amines, and also meats that are cooked for long periods of time. It's just changes that happen inside the animal proteins that cause it to form these, and they've been found to be cancer-causing agents. They damage cells. Heme iron that's found exclusively in meat. Heme iron it's not the regular iron that we need in our diet, but heme iron is a breakdown product of hemoglobin. Hemoglobin is found in the red blood cells that are in all animals. So when the hemoglobin's broke down, it forms heme iron. Heme iron is a very powerful free radical that damages cells. That's why they know that it does that. The other thing is IGF-1, which is insulin-like growth factor 1. That is a growth factor, that a hormone that's produced by our bodies in response to meats. The reason that it's a problem is it speeds up the proliferation of cells. So if you have a tumor already developing in your body, it's going to cause that to rapidly multiply even more so. There are also endotoxins in meat. They noticed a while back, researchers noticed that there was an interesting inflammatory response in our blood vessels that occurred after eating animal products. And they were trying to figure that out. They went through several different hypotheses, and what they finally realized is there's bacteria that's found in meat products that produce what are called endotoxins. And in response to endotoxins, the muscles in our blood vessels go into spasm and stiffen those blood vessels, all right? So what happens, that happens about an hour after we eat meat, and then about 4 or 5 hours it dissipates. But then what happens 4 or 5 hours after our meal? Most of us eat again, and so if we're eating meat products, it happens again. So these repeated inflammatory insults to the blood vessels have caused cancer to develop as well. It also speeds up the process of atherosclerosis, so it's implicated with heart disease as well. And then the other thing are the hormones that are found in dairy and meat products. They're hormones that are introduced to speed up the growth of animal products, to make sure our animals get as big as possible, as fast as possible, so they can get in the market faster. Also, in dairy products, there's estrogen found. Dairy cows are kept pregnant all year round. They constantly keep them pregnant time after time. So you're eating You're consuming products that have got a lot of estrogen in. Estrogen's been indicated in prostate cancer and breast cancer. So a couple things that you want to avoid for that reason. Our Texan doctor, Dr. Ornish, we talked about before, after he took on heart disease, he decided to look at cancer. Can we reverse cancer? And he looked specifically at prostate cancer. What he found with prostate cancer, he put together a similar study, what I told you before again, and yes, in fact, he found that in the blood test that he did, that men's ability to suppress cancer cell growth was increased by 8 times. I'm going to explain that in just a minute. And he also found in biopsies they did with men, he put on the same regimen he did with his heart disease programs, that he found the biopsies that there were the tumors had shrunk in time over as a result of these programs. So once again, we found that we can actually reverse cancer through this as well. One of the interesting things they do to find out how these diets work, they grow cancer cells in petri dishes. So they can take prostate cancer, grow it, breast cancer, grow it, and then they've taken the blood. And by the way, in all of our blood, we have cells that kill cancer. If it wasn't there, we would all die from cancer. All right, that's just the way it would be. So we have the ability to kill cancer in our blood. And what they did was they take these cells and they take samples of blood from different people, and then they drip them onto the cancer cells and see what happens. So they know kind of what that normal range is. And then they decide to experiment with this. One of the studies they did, they found that people who had taken part in strenuous exercise over long periods of time and had a vegan diet, their cancer killing abilities were hugely improved over those of us on a standard American diet. So they tried to separate that out to look at, is it one or is it the other? What they found is people who took part for like 10 years, big exercise people, lots of exercise, they found that their cancer killing abilities were increased by 2,000 times. But when they added a vegan diet on top of that, it increased by 4,000 times. So that's how powerful this is in terms of strengthening our blood and helping it to fight cancer. So this is an example. I don't know if you can see, if it's too small to read in yours or not, but I put some examples of some foods that help our body fight off cancers. The first thing I want you to notice is the range of colors in there. All right, we've all been told to make our plates look like a rainbow, right? The reason why that is the different colors represent different phytonutrients. Phyto means food, so different nutrients found in our foods that help to fight things like cancer. I'm not going to go through every one of them, but I want to point out a few of them. If you add anything to your diet as a result of our talk tonight, I want you to think about cruciferous vegetables. Cruciferous vegetables have cancer-fighting compounds called sulforaphane in them. And what are cruciferous vegetables are things like cabbage, broccoli, kale, Brussels sprouts, collard greens. All those are cruciferous vegetables. So by eating those, you automatically increase your body's ability to fight cancer. Another one, flax seeds. They have to be ground, otherwise they go right through our system. But in the prostate studies, what they found is eating 3 tablespoons of ground flaxseed a day decreased prostate cancer. I can't remember the specific amount. It's in Dr. Greger's book, but by a huge amount. It also was found to increase women's ability to fight off breast cancer. So it's an excellent additive. All you do is grind them up. You can grind in a coffee grinder, cut 2 or 3 tablespoons a day, and it makes a huge difference in your body. The compound in flax seeds is lignans, and it binds to the cancer cells and helps get them out of your body. Fruits, berries in particular, are very high antioxidants, help to fight cancer. There was one other I was going to mention, and I can't remember what it was off the top of my head, but you get the idea. So those are some things we can add to our diet to help. All right, so what do we eat? I'm coming to the wrapping up of this. First thing you probably noticed by now, and before I'll get to that in a minute. Eat a plant-based diet because it increases the body's ability, it reduces the risk of heart disease, cancer, obesity, and diabetes. Avoid cholesterol intake as much as you can. Our body doesn't need it. It winds up causing the problems we talked about earlier. Decrease your fat intake, especially saturated and trans fats. And lastly, increase your fiber intake. Now, some high fiber foods, specifically soluble fiber, are oats, barley, apples with the skin still on, sweet potatoes with the skin still on, beans and oranges. So these are things that we can eat that'll help us with our fiber intake. Make sense? All right. So some of the benefits of a whole food plant-based diet. Number one, it helps us better manage our weight. All right. You fill up more when we eat vegetables and fruits than when we're eating animal products. Fat has more calories than carbohydrates do, so it reduces that as well. It helps prevent diseases. All the things I talked about, I tried to bring that into the talk today, but specifically we've seen it prevent, halt, or even reverse chronic diseases like heart disease, type 2 diabetes, and certain types of cancer. And the other thing is it creates a much lighter environmental footprint. I'm not going to go very far down that path today because that's not the purpose of this talk, but I will tell you, the more I looked into this way of eating, the more convicted I became of our responsibility to our planet. Some of the numbers, I didn't bring it in here with me, that's right, but there's a book up here called Uncomfortably Aware by Richard Oppenheimer. If you're interested in finding out more about it, he talks about the impact that raising animals for food has. In order to produce 1 pound of beef, it takes between 10 and 20 pounds of grain. To produce a pound of vegetables or fruits takes 20 to 50 gallons of water. To produce a pound of beef takes about 2,000 gallons of water, between the amount of water the cattle drink, to the amount of water that goes to watering the feed that goes to the beef, to cleaning the nasty slaughterhouses after they're used. I think it's 70% more land is required for beef-based compared to plant-based. One of the documentaries I watched said if we all went to a plant-based diet, there would be no starvation problem in the world. We could raise plenty of food to feed the whole world, and we could eradicate the problems we have with malnourishment in different parts of the world. So I won't go further with that. I'm going to share something with a minute if you're interested in looking up that further. But that was one of the things I was convicted on, and I'm convinced a diet that's beneficial to the planet is beneficial to us as individuals, and vice versa. So this is what a whole food plant-based diet looks like. All right, you're going to eat fruits and veggies. That's pretty self-explanatory. And you're going to eat tubers. Tubers are root vegetables. Okay, like sweet potatoes, radishes, what else? Carrots, beets, things like that. Whole grains. We know what whole grains are. And then legumes. Everybody know what a legume is? Those are beans, peas. They're grown in little pods. So very high sources of protein and also of fiber. So that's basically what a whole food plant-based diet looks like. All right. So for some of you, you may be sitting there going, man, that's pretty radical. That's pretty extreme. If you had told me a year ago I was going to be eating this way, I would have said, no way. I love my steaks. Caldwell Esselstyn, who's another one of my heroes. I'll talk more about him in a minute. He's a famous cardiovascular surgeon. He said some people think a plant-based whole food diet's extreme. Well, guess what? 500,000 people a year are having their chests opened up, a vein pulled out of their legs and sewn into their coronary arteries. I don't know, some people might call that extreme. That's what happens with a bypass. And that's what a lot of 500,000 people a year go through that. So let's say it's a little too extreme to look at right now. I understand that. But even if you just start make changes and you limit it, some people go to a meatless Monday and they take meat into their diet. The more that we reduce our meat intake, the better our diet's going to be. The more we can use whole food, plant-based into this. I was reading Dr. Greger's book, and he said, somebody came up to him and said, I can't do that. My favorite food is my grandmother's chicken soup. I'm not giving that up. He goes, great, don't give it up. You know, but you can still make other changes that are going to benefit you. So I share that with you along those lines. Now, there's one other piece of this that I want to talk with you about because it's very important. So I'm preaching to the choir to a large extent, but we can eat all the right foods, we can do all the right things. But as you all know that are patients here, everything in our body is controlled by the nervous system. So similarly to the way that our pancreas can produce insulin, but it doesn't work if we're clogged up, if the nervous system isn't functioning better, then it's not going to matter. We still can't properly use the foods that we eat. So it's critical that we have our nervous system functioning better. The way things work in our body is there's a constant flow of communication from our brain down the nervous system to every muscle, tissue, and organ system in our body. That's why our nervous system is our master system. So it goes to the pancreas, the immune system, the heart, the things that we were just talking about. If we don't have those properly controlled by the brain, then those systems aren't going to function properly. And what interferes with that, as those of you under care here know, is a condition called subluxation, which is where the vertebrae become misaligned, which puts an endangering stress on the nerves where they exit at that level. And that interferes with those signals, and depending on where those signals go, determines what shows up. There was a study done by Dr. Sue where he looked at this. And in his study, feel that and pass it around. If you want to take the dime home, you're welcome to. Yeah, this is a dime I'm passing out. I want everybody to just feel what a dime feels like and pass that along. If you need a dime, feel free to take it home. Share that with your kiddos. What he found in his study, the study he did, they put pressure, the weight of a dime, on an exiting nerve, and they found it altered the function of that nerve by up to 60%. So it doesn't take a lot of pressure to impact the way the nerve functions, all right? That's why I passed that dime around to drive that home. So if that nerve happens to go to something like the heart, we can eat all the right foods, but the heart's not going to function optimally. If it goes to the kidneys aren't going to function optimally. If it goes to the immune system that determines whether or not our body properly fights off cancer, we're not going to be able to fight that off properly either. So that's the role that the care that you're receiving here plays in this. We want your body to function absolutely optimally. Does that make sense? Let's say I piqued your interest a little bit and you want to find out some more. All right, in your sheet, I listed for you 5 people that I've been researching that have just blown my mind. Michael Greger I talked about. He wrote this book, How Not to Die, and he also wrote a subsequent How Not to Die cookbook. His latest book he just put out is called How Not to Diet. One of my patients, I thought she was going to be here tonight, she's not. She's bought that book and is operating from that. But he also has a website called nutritionfacts.org. What I love about Dr. Greger, he's a medical doctor. He is a voracious researcher. Every year, his staff reads every single article written on nutrition that's published in the United States. Everything put out in the peer-reviewed journals. And he takes his findings and summarizes and puts them in a year-end summary of all the new findings. And he said every year it's different because they learn new things every year. Also, if you go to his website, he's got tons of little 5-minute videos on different health-related topics. So it's an excellent resource if you want to find out more about just about anything relating to diet. Neil Barnard is the gentleman that I first listened to. I heard him talking about diabetes. He has a book called Program for Reversing Diabetes. I'm a big fan of his. By the way, all these guys have got talks on YouTube. That's where I started, and you just Google their name and listen to some of their talks. T. Colin Campbell is kind of the granddaddy of all these guys. He's the one that did the China study. He grew up in a cattle ranching family, and his initial intention when he started down this path of research, he wanted to prove the importance of increasing meat intake in some of the countries that were having cancer problems to reverse it. And as a result of the research he did, particularly in China, now he is one of the biggest advocates out there of a whole food plant-based diet. He's an older gentleman, but in the videos I watch, he's out jogging at 80-something years old. Caldwell Esselstyn was the guy whose quote I mentioned a second ago. I respect this man tremendously. He's a cardiovascular surgeon. Where does he make his money? Doing cardiovascular surgeries. But what he does with every patient that comes to see him, the first thing he does is he puts them on a lifestyle modification diet. He puts them on a whole food plant-based diet to try and reverse their heart disease through diet. Right? He doesn't make near as much money doing that, but that's what he does for the patient's benefit. He's got multiple published studies where he has shown the reversing the cardiac vessels open up, and that's been his passion, what he shared with the world. He's got a book called the Prevent Reverse Heart Disease and Prevent Reverse Heart Disease Cookbook. And the last one, Dean Ornish, I already talked to you about Dean Ornish. Originally he did his book on reversing heart disease. His latest book is called Undo It, How Simple Lifestyle Changes Can Reverse Most Chronic Diseases. All these are excellent guys. Like I said, if you want to find out who they are first, Google them, listen to some of what they do. You can go to their websites. I don't have a website for Caldwell Esselstyn because he's got several of them. But again, if you're curious and want to find out more, go ahead and look these guys up, and you can get a lot more detail than what I shared tonight. Now, if you are convicted, like I was after this, and decide you want to thinking about doing it or know you want to try this, Neil Barnard put out a book called A 21-Day Weight Loss Kickstart, and it's a book on a vegan diet. So what he recommends, if you purchase this book, in it he's got recipes, he's got a meal plan to do a 21-day vegan diet. What he suggests is this: before you do it, read through the book, get some ideas, and then he says look at your own diet first. Pick out some foods that you eat that would qualify, that you know you want to continue to eat, and then look at some that you may or may not want to. Then look through some of his recommended meals, and then put together a meal plan that you're going to do a week from now. The day before you're going to start, go do your shopping, get it all together so you're ready to go, and then after a week of preparation, that's when you start his 21 days. And what 21 days does, it gives you an opportunity to experience the changes. The changes I experienced was I immediately lost weight, lost about 10 pounds as a result of going on that. I've started running again for the first time in about a decade. I had to quit running a while back because it was too painful, too much pain in my joints, specifically my back and my knees. I've been able to start running again because I don't have pain in my joints anymore, because the inflammation has left because of going on this diet. I sleep better, except when I wake up worrying in the middle of the night about doing this presentation. But this book is very helpful, and he also has an app that you can download, which is called the 21-Day Vegan Kickstart, or you can go on his website and you can register, and he'll send you emails to help you get the program started. So that's for people that are pretty confident you want to go that route. The other thing you can do is I've listed some documentaries that you can watch. The first one I'd recommend you watch if you want to find out more. You can get it on Netflix. It's Forks Over Knives. Okay, I've got the Forks Over Knives cookbook up here. It's pretty easy to get through. Several of the guys I mentioned on the other page, they interview them, talk about how to implement things in your life. They do a little bit of expose, but not too much. But it's a very powerful movie. Gives you reasons for why you might want to do it. Game Changers, number 3 on the list, has recently been released. It's a brand new, real trendy one. They spent a lot of money on this one, so it looks more Hollywoodish. Arnold Schwarzenegger.
It's got a guy that did the military training.
Yeah.
I became a vegetarian just a month ago because of that.
Because, yeah. So a lot of guys, Arnold Schwarzenegger's on there. Arnold Schwarzenegger said back in the days when he was, the top bodybuilder in the world, they were all told, real men eat meat. He's a vegan now. All right, and so it's amazing what's happened, how things have changed. So that's a very good one you can watch. Now, What the Health is one I watched. It's a low budget documentary, but a guy goes around and it's very interesting. Now you'll notice 3 of them I asterisked. The reason I did those are hardcore exposés on the animal industry, and there's some very graphic scenes in some of those. So if you're disturbed by graphic scenes, you might want to pass on those. But if you watch some of these and want to find out more, you can go there. So where I started, like I said, was with Forks Over Knives. Give that one a watch, or Game Changers. Game Changers is also excellent, like I said. So I come to the end of my presentation. I want to thank you guys for being here tonight.
Just one question?
Yes, sir.
What about what you drink? Milk, obviously, dairy, right? Can you say just anything at all about, like, what do you drink? Did you change that at all? Is it more water, or is it,
Well, I switched from milk to alt milks. So almond milk, there was a study that showed that drinking milk, I can't remember the type of cancer they showed the increase in. Milk raised it by 30%, almond milk lowered it by 30%. The alt milks, almond milk, soy milk, rice milk are much better options. They taste very similar. If you still want to eat your cereals, whole grain cereals, you can put those on there instead. Increase that. I still drink some juices. They're higher sugar content, water. One of my downfalls is coffee. I haven't given up my coffee up yet, but primarily go to water instead of those. If you're used to using milk, you can try different alt milks. I like to get them unsweetened. It's more healthy.
and when you shop for vegetables or vegan, how big a difference is organic versus not?
Well, that's another lecture.
Okay. Okay.
Organic, you're going to cut out the pesticides. You're going to get a cleaner, usually more nutrient-dense product. It is more expensive. If you're going to take a step-by-step, just try introducing vegetables. If you want to go totally to the healthiest option, you would go the organic route. It is going to cost you more to go that way.
Okay.
And by the way, one of the reasons some people give for not wanting to go vegan is what's going to be more expensive. It's not. My wife, we've been practicing that. She's going, oh my gosh, we're spending so much less on groceries now. The money goes into the animal products. We just don't realize that till we try it. Well, thank you guys for being here. I hope you found this useful. Like I say, if you're interested in experimenting or finding out more, hopefully I gave you some resources you can do that. If you've got people in here that you care about, share this information with them. And one other thing, I talked about the spinal health. Many of you are already patients here. We did attach to your packet a health pass. And that's that low-cost way to get started in our office. I think we ran out of them as we were attaching them. If you've got somebody you care about that you would like to have come in and get checked, the initial exam with the x-rays through that initial report of findings, if they present that to us, we'll do it for $67, which is a huge savings over what we normally charge for that. Or if you're a guest here and you'd like to be checked, we'd also encourage you if you want to utilize that. But again, most of our practice comes through referrals, so if there's people that you care about, send them in here. We'd love to be able to help them as well. And I hope you understand we share this information with you guys from the bottom of our heart. We want to help our patients be the healthiest patients in Austin, if not the healthiest patients in the world. So thank you guys for coming out tonight.